Y'all doing? Thought I'd make this video while I have the chance, while I can still speak. I have a dental abscess. My whole side of my face is swollen. And the question is, have I been sent home to die because of COVID-19? Here's why I say that. Because the urgent cares will not touch me. The dental abscess I have needs to be lanced in order to take care of it. And it can't be lanced because they won't touch me. They will not surgically intervene with anybody. What they did tell me they would do is give me a prescription for antibiotics. And if I needed a refill on antibiotics, they would prescribe that, but they would not intervene any further than that. So I think now I understand why when I walked in there, they took my money up front before they even had some kind of consultation. And the parking lot was empty and the waiting room was empty. I think everybody knows they're not getting any services at all. Ended up calling around. No dentist is open. Not in my state. Ended up finding a government clinic who was open and did offer emergency services. And they told me the same thing was true for them. They said, we're going to tell you the same thing that urgent care told you. We're going to give you antibiotics, as many as you need, to treat an abscess that needs to be lanced. But we're not going to do it. Understand? So, a couple of days go by, those antibiotics aren't doing anything. The pain is phenomenal. The swelling is phenomenal. I wonder if I'm going to wake up one day and not be able to talk anymore. You know? Because these doctors and dentists have hung us out to dry. Honey, they have abandoned us. We're not going to get any intrusive medical care. So I found another dentist who was not open for business, told him the situation, told me he was going to prescribe me a stronger antibiotic. So I'm taking it, and again, like the infection started up here, now it is all over up in here, and like there's a sac forming down here. Like it's you know, hey, if this shit kills me, are they going to put COVID-19 on my death certificate? America, you better not have a tonsillitis. You better not need no tubes in your ears. You better not so much as have a hemorrhoid that needs to be lanced. Okay, I'm trying to tell you, they're not going to touch you. And I think now I understand why doctors are forced to write COVID-19 on the death certificate for all these patients that are dying in the hospital, because all the hospital's going to do at the ICU is make you comfortable. Honey, they are not going to admit me into the ICU, cut my face open, and get rid of all of that infection like they normally would. They are not going to touch me. They're going to give me a morphine drip, and I'll stay there till I die. They'll make me comfortable as I pass from said infection. This is terrible. Like, my next video is going to be a last will and testament. Listen, if little Johnny fall out that tree and needs stitches, honey, you better know how to give them. You better have some Novocaine somewhere, because they're not going to sell it to you over the counter. So you better have a stockpile of these medical supplies, because if somebody get hurt and need physical intervention surgically, they're not going to get it. A tooth abscess is a fairly simple procedure. You're in and out the door, you know, in the time it takes to Novocaine you. And they're not going to do it. And then this lady at this clinic had nerve to tell me, when I told her, now you know full damn well, antibiotics are not going to cure this. Had a nerve to tell me, yeah, but in a few weeks, it'll control it, and within a few weeks, you'll be able to make an appointment with an oral surgeon or somebody. What's happening in a few weeks? Well, Trump said he was going to open the economy back up in a few weeks. Trump has said 18 different things from Sunday, and none of them come to pass. It was only supposed to be 14 days, and then it was supposed to be on Easter. And now you want to tell me what Trump said? Trump said, in a couple weeks we're going to be open for business. Are you crazy? What is going to significantly change so much so that all of a sudden doctors are going to be willing to operate on people as life as usual? And we have gotten nowhere in this COVID-19 discussion. No vaccine, not enough tests. We still got all the same arguments we had in the beginning of this COVID-19 situation. But what they're not telling you on the news is they are only making people comfortable to die. Whether you are dying of full-blown AIDS, full-blown COVID-19, or full-blown cancer, or whether you are dying from a splinter in your big toe that has turned gangrenous from infection because you couldn't get nobody who would touch you. It is what it is, America. That is the hard, honest truth. That is what it really looks like, and I'm living it. I can't go back to work like this. Do you think the unemployment office is going to give me unemployment because I have an abscessed tooth that I cannot have taken care of at the dentist? The infection has gotten out of control. I'm now running a slight fever because of it. It has nothing to do with COVID-19. You think for a second that the unemployment office is going to cut me a check? Probably not. I can't go to work like this. My face is killing me. My immune system is officially compromised. How am I going to pay my rent? I guess I'm singing everybody's song, huh? God bless everybody out there. Hey, listen, if you haven't given your life to Jesus Christ yet, I suggest you do it, honey, because if you need a doctor, you're not going to find one. And he's the only one I know who's been in the business of, healing the sick and raising the dead and, giving sight to the blind. So if I was you, I would start calling Dr. Jesus, because the real doctors and physicians in our community that we have paid thousands and thousands of dollars for to live in those pretty houses on the hill have abandoned us. But yet they're still getting paid to have their doors open and charge you $140 to look you in the face and say they're not going to intervene. But we'll be your drug dealer. What kind of drugs you want? We got them all. Tell us the drugs you want. We're going to give them to you. And that's all they're going to give you. Look here, this hurts. I gotta go. I'm gonna put, a hot rag on my face. This is just freaking terrible. God be with me. God be with you. God bless everybody out there. Don't mess around and get a hangnail or anything. These people are not going to touch you. They're gonna send you home to die. Bye-bye.